Okay, Emma, over to you.
So, hi everyone, my name's Emma. I am 23. I perhaps might be the odd one out in that I'm actually based in the Salisbury Spires Clinic, so I would have had not this team, which might be an advantage because my doctor's up here, so I can be brutally honest. But okay, so a little bit about my surgery. It's been nearly 5 years actually since I had my surgery. I had it when I was 18, back in 2012. I've had lots more surgeries since then, including my nose, implants, my chin, etc. So I'm also happy to ask questions about them as well. But why I had the surgery, I think it's probably going to be a really common reason. I was very self-conscious. I didn't really like how I looked. It'd been something that played on my mind, my whole life. I was very conscious of what angle people would look at me, and I wanted to make the most of any opportunity and take the advice of my doctors and hearing what they could do. I knew what I wanted. I knew I wanted to have stronger cheekbones, to pull my teeth forward because I have very small teeth. I wanted to be able to you to be able to see my teeth when I smiled. So there's all these very cosmetic reasons why I wanted it. And I will let you ask questions in a second, but I think the biggest thing to say is that my advice would be get it while you're young. It is a big operation and it does take a good few months to fully recover. But my advice would be to say do it while you're still young. You're not necessarily in a full-time job because it's a lot easier. And I never regret the surgery. It's hard. Nothing in life is easy. It's definitely hard, but never regret it.
Excellent, excellent. Does anybody want to go next?
Are you happy with where you look now?
Yeah.
Or you still want to have more surgery? Or?
I'm currently having a little bit more work done on my implants. I'm just going to have them made just a tiny bit longer, just so when I'm at rest without smiling, I would like just the very bottom of my top teeth to show. So I'm currently just in the process of that now. So by the summer, hopefully I should be completely done.
I've asked you this before, but are your expectations of the surgery, were they as good as you expected?
I think it's a difficult question because you never quite know what you're going to look like, so therefore you can kind of go into it thinking, gosh, I'm going to come out looking like a supermodel. But having said that, I'm not disappointed at all, and as my swelling started to go down, I could see a difference straight away, and I was really happy that I could see a difference because it makes all that pain worth it. So I think it's hard to say whether it met my expectations. I don't really know what my expectations were. Definitely happy with the results.
Chris.
So I'm Chris, I'm 22 years old. I had my jaw surgery in the summer of 2013, just before I went off to university, and I think I would give the same advice generally as if you have the opportunity to get it done before you go off to uni. I think do that, because obviously if you are perhaps feeling self-conscious about how you feel, it's a good way to kind of put your mind at rest as you're about to go through a big transitional phase generally. The reasons why I had it done, I think mainly it was for aesthetic reasons, but it was also sort of to improve my bite, so there was also some sort of functional element to it as well. That was always in the back of my mind. And I mean, I was a little bit unfortunate in that mine did relapse after my first round of surgery. So I had it done, and then after a few days sort of went to have a checkup and was told that I would need to kind of have it done again because my jaw had sort of tried to slip back a little bit, which obviously is not the best thing you want to hear. So about 2 weeks later I went and had it done again. However, despite the fact that I was in a minority where that does happen, I don't regret having it done at all. I think it was one of the best decisions I've made. So I mean, I think really, if you weigh it up, I mean, and obviously you will have discussions with the medical professionals, and obviously it is your own decision, and if you weigh up the benefits and cons. But I think largely for most people, I think the pros will outweigh the cons really, and the risks too.
Do you feel that it's changed your life?
I think yes. I think I would say that. Yeah. I mean, it's strange because people ask me, did I feel super self-conscious before I had the surgery? And I don't think, my honest answer to that question would be, I don't think I was super self-conscious. But having had the surgery and looked at myself in hindsight, in retrospect, I can see the difference now, and I now feel a lot better about how I look in comparison to what I did.
And do you feel more confident?
Yes. Yeah.
Chris,
Hi.
did you think that we prepared you enough for what to expect?
Yes, I would say so. Yeah, no, my team is here. They're great. They're amazing people, by the way.
Surgeon isn't though.
Oh no, my surgeon isn't, but he was very nice as well. Yes, I would say. I think I did hesitate for a little bit coming to a decision, and definitely having the meetings where you have sort of all the options weighed out to you and all the pros and cons. Those were definitely helpful. So I think from that point of view, to answer your question, yes, I think I was prepped in the right way. Yeah.
And what about the surgery itself and what to expect? You know, there's that week and 2 weeks.
As in before.
Yeah, so you always tell you about Philippines and all the rest of it.
Yeah.
Do you think we prepared you enough going through all of that?
Yeah, I would definitely say so. Yeah.
Does anybody else want to move on to me?
So I had my jaw surgery in October 2014. I'm 23 now. And my jaw surgery was a long time coming because I was a massive thumb sucker. So I was a nightmare for Priya and Bridge because I would not stop sucking my thumb. So I had lots of different retainers in and out trying to get me to break this habit. And it eventually got there. And then I was allowed to have my surgery. And I remember on the day thinking, why I sat with my mum and mum was like, why are you actually getting it done? And I thought to myself, I wasn't massively self-conscious, but looking back on pictures, from the side, I was like, oh, there is a massive difference. My bottom jaw was incredibly forward to what my top was, but I didn't realise it until after. And then you think, well, had I have known, I would have been so self-conscious of it, but because I didn't know, I wasn't. So going forward, I think maybe get someone to take a proper side angle of you and actually sit and examine it and think about it, because that's what I wish I'd properly done. To the point where you would have looked to see what the difference would have been, because I don't regret having it. I'm still in the process of having further work done. I had my last surgery in January last year. That was my lip and my nose, and every surgery I've had since, and hopefully going forward, I wouldn't have regretted. And I think it's a blessing that we can all say that we have the choice to have it. It's not forced upon us, and it's a choice that we can all make for ourselves. I think we all agree that it's probably one of the best things that we've done, but not knowing at the time, if that makes sense. Yeah.
That's good. That's good to hear. Ed, I think you're the youngest of the four of you. What was your experience?
Up until about 16, I didn't really care about the cleft lip. I didn't notice it. But then after that, I got a bit more self-conscious. I really noticed it when I was in changing rooms or something, when there's mirrors everywhere, and you see a side view of it, and then. Yeah, from there, I didn't really think much about the surgery. I knew that I wanted to have it done just to get a better profile.
Yeah. Well, we've seen both of your pictures, and I mean, I think that everybody could agree the result is. I was quite amazed with the result. I mean, if you see the clinical pictures, it just really brings it forward what can be achieved.
It's definitely worth it. It's not all it can do is make you look better. It's not. it's not going to break. Yeah.
It's not going to make it worse, yeah. And how, I mean, I've been emailing to Chris, not to you, because you very kindly put yourself forward today to speak. But I said something about please share with us the good, the bad, and the ugly. And I do really mean that. You know, because there will be moments that, I mean, you touched upon that. You'll vomit. Those are things
I
that
was
are.
sick as well after.
Yeah.
I thought it was just me, but I was sick as well. And
Chris was as well.
oh wait,
Okay, so that's normal.
because your jaws are wide shut, it's like it's not a very attractive sight, and it's blood, so it's and you're looking around, and you're just. And I think also one of the big things for me was it was my first operation outside of Great Ormond Street. So Great Ormond Street, you're in a very cosy, like, nice environment. You're allowed to have your mum in there, and you're allowed to have your cuddly toys, and it's all very nice. And then go to UCH, not that they weren't nice, but it's an adult hospital, so you're not allowed, you don't have that freedom to have your mum come in with the anaesthetic room. So it's one of my first surgeries without my mum there, and it was a big thing for me because I was like, she wasn't there. She wasn't the last person that I saw when I went to sleep, and she wasn't the first person there when I woke up. I had to ask for her, which isn't normal because at Great Ormond Street, she's the first person you see when you wake up. So I think for that, and it's a big thing for you to think about that. It's an adult step, and it's a big step into adulthood as well, because it's the first thing that you decide that you want to do for yourself. I mean, I had mine when I was in full-time work, so for me, I had to take time from work, and I work in a nursery with children, so for me to have to go back to work, it was a big thing for them to understand as well, because I looked different, and I went back to work probably a bit earlier than I should have, because I was still incredibly swollen, and it was a big thing for them to understand, why do you look like a football? Why is your face so round? Because it was so swollen, and
You look like a puffer fish.
yeah, you
It's
literally like you
a
wake
week and a
up
half.
and the next morning, like one side is bigger than the other, and then it goes to the other side, and then you just think like, what? When is this going to stop? Like, am I going to get smaller?
Yeah.
And then you do like get there eventually. And
Do you think people treat you differently after your surgery? Do you think so before you had your surgery, people looked at you different, and now they're looking at you differently again because of how your face has changed, or you get more questions, or you get more kind of looks or stares, or
no,
Not really.
I mean from someone that's been to school and stuff, I've never really, and luckily, never really had that. People be like, what's wrong? Like, why? And if someone has said what, and I've always known what to say, but I personally haven't really had to deal with anything like, what's wrong with that? Like, what's wrong with your nose?
Yeah.
It's never really been an issue for me. I don't know about anyone else.
I think a little bit slightly different. So obviously growing up, I wasn't bullied, but I did face those questions, and I was very, in a family environment, I was never treated any different, so I never really knew how to respond, and I felt almost, why are you singling me out? I don't want to be different. Why are you asking me, why my face looks funny? I always got told like my face looked flat, all those sorts of things. Which when you're a kid and you didn't know, I wanted to just pretend I didn't have a cleft and just get treated like any other normal child. And I think what shocked me actually after having the surgery is I thought I was going to look really different. And for me, in how I perceived myself, I did look different. But going back into work and seeing my friends and my family, no one actually really noticed because, and I'm slowly learning this as the years go by, perhaps because I'm getting older, but actually people know us for us and not because of our cleft. So I've had my nose done and people didn't even notice that. And they say, where have you been for the last 2 months? I go, oh, I've had my nose done. This is what it looked like before. And they're like, oh, I never even noticed. And you're like, oh, was there any point? No, of course there is. You do it for yourself, you don't do it for other people. So actually, what other people say before or after your surgery doesn't matter because you do it for yourself and to be able to walk out that door and feel good about yourself.
I remember one thing that our previous chair told us, and he, how old is Chris? 26? I think 26 this week, no? And he, so he had the jaw surgery done. It's really real shame actually that he couldn't be here. But one of the things that he said, and Breach, he said like, oh, I was not prepared at all to how I looked immediately after surgery. And so he found that the whole coming home with a very, very swollen face and looking at himself in the mirror, he found that very, very difficult. So was that an issue for you, that initial panic, or when you see yourself in the mirror with all the swelling?
Yeah, yes, yeah.
I was told to take arnica before surgery because it's something that helps reduce swelling and bruising.
Yeah.
I didn't actually do it.
No, I did.
I didn't do it because I couldn't run out of time.
Pusher.
Oh, no,
yeah,
yes,
for
I
like a month before my surgery, I always take arnica.
Oh, I didn't take it, but I remember I've got a photo and I actually showed someone of me the day after. And yeah, I mean, I have a photo of me the day after. And I've got I think I've got a 2-weekly log of photos, and they progressively get worse. And my face literally gets bigger and bigger and bigger. And then, yeah, see, mine's pretty much.
Oh, that's not as bad as that. Okay. So is that immediately after?
That's
like the
the
day after.
Okay, so that's a lot less.
The day after.
I look more like this, yeah.
And then, but then it got worse. and then it just got bigger. It literally gets bigger and bigger. And it's just, I mean, I look back at now, me and my friends actually laugh. Like, it's funny to now look back and laugh and be like, look how swollen I was. And I mean, and it's good that you can now look back and laugh and actually take from it and be thankful that you had the opportunity to have it done, because some places you don't get it free, like, and it is a massive thing that everything, CLAPA, gosh, I'm very thankful for it, and I think my family is as well. And I would definitely recommend it to.
I think Mr. Hay made it like quite clear that we were going to be quite swollen after.
Okay, good.
They were pretty clear about that.
I think because obviously everyone has a bone graft when they're 8, 10, whatever age. That obviously makes us all very swollen as well. So the swelling side wasn't such a shock because they very much prepare you for it and you kind of expect it and you've already seen yourself, although perhaps 10 years prior, already looking like a football. I think the biggest shock for me was having my teeth wired together, and I had my teeth wired together for about 6 weeks, which I think that's probably one of the toughest parts, because if you're in pain or if you're uncomfortable, and when you're then in an adult's ward as well, so you're very much used to having your mum there and she can't be there all the time, you can't talk. One, you're swollen, so that hinders your talking anyway, but then to have your teeth tied together, trying to explain to a nurse who probably isn't specialised in clefts, how you're feeling and what you need, just can you help me go to the toilet, was really difficult. So I think the biggest shock was definitely the teeth.
So you said your teeth were together for 6 weeks.
Yeah.
Is that abnormal? Is that normal?
We don't that. We don't wire routine. We don't
Okay.
I don't know. We don't wire teeth together.
Mine
Okay.
weren't like.
Yeah.
No, you had some
Elastics.
Yeah, mine were
Okay.
elastic.
And sometimes the elastics
Okay.
are tight.
Okay, so that
Mine
differs
were
from
tight,
yeah.
But I couldn't get a spoon or anything between my teeth.
I tried personally
Most
for the
was
first few
straw.
days. I actually don't put them on too tight. You actually, when you come to your first week appointment, that's when they get a bit tighter.
Yeah.
Just so that when you actually go home, you can actually move a little bit. You should be able to anyway.
Yeah, I couldn't. I remember distinctly because I got through a lot of ice cream because that was something that could go around the side of my
Was
teeth.
it a flood that did yours?
Yes.
Yeah.
I remember the fridge with milkshakes in smoothies.
Yeah, so many smoothies.
There were so many smoothies and milkshakes, and I
Back
was
to
just
baby
like,
food.
yeah, literally, I was like, I don't want this anymore. Like, no, my mum was just sitting there and eating steak, and I was like, that's not good. I'm like,
Yes, go ahead.
Can I ask a question of all of you, which is, did you both have the top and bottom surgery done? Okay, and then did you notice anything in the speech, because you talked a lot about, sort of how you felt you looked and so on, but was there anything in terms of your speech that you felt changed, or you had to adapt, or felt a little bit alien to you or anything?
My mum said it sounds a bit nasal. But
No.
I went to the speech therapy last week or 2 weeks ago, and they said it's borderline, so it's not much difference from
Yeah.
before.
I don't notice, speech-wise, I don't notice anything.
So I had top at bottom,
I was just top.
so I didn't notice and haven't. No one said anything. I think clefts always sound distinctive anyway. I think you always have that nasally lisping kind of thing. So I think you can pick up when someone has got something there. But I don't think
it changed.
I don't think it changed as much as. I mean, like they told me it can really change, and that was one thing that I was
I was kind of worried.
worried about it. That's what I was worried about is my speech. I don't want to sound different as well as look different. I don't want to be a completely different person. But they can always try and change it as much as they can after. But I didn't notice anything.
No. They plan to do top and bottom for me, but just did top for the
Regarding speech, I don't think. No, I think if anything, I would say my speech has probably got better afterwards. I noticed that my enunciation is a lot better than it was before. That's not to say that my speech was poor before, but I've just noticed that it's sort of a bit more. I just sort of maybe a bit how I actually just enunciate. It's just a bit more refined than it was before. Which I think goes back to the point I made earlier in terms of just the whole sort of functionality of your teeth and stuff like that, and it does help sort of all comes together. Yeah.
Were there any more specific questions?
Can I just ask, is any other parents here?
Yeah, Val.
Do you feel that you're prepared enough? I'm one of the juniors working with Caroline. Do you feel as parents that you're prepared enough for the changes that's going to go through your child over that sort of the first 4 weeks particularly?
Well, for us it was tough because obviously he had almost an immediate relapse. So yes, he did come out with his jaws wide shut and then trying to find anything. Because you were saying about the ice cream going around the back, that was it.
It's very true.
Absolutely, couldn't even manage blended Weetabix
No.
because his jaws were that wide shut. So that was shocking. And the fact that I then had to take 4 weeks off work to just be with him and nurse him through that. I also noticed the difference in his confidence. And the fact that you probably don't remember this, but you didn't like smiling before your.
Why not?
Every picture that I took of you prior to getting your jaws done, you didn't smile.
I was the same.
That's the same.
It's good to know that. We're ubiquitous in our sort of obliviousness.
I don't know whether that's a conscious decision or not, but afterwards, beaming all over the place.
That's exactly the same. I didn't smile.
But I think one of the things that you have to also remember is that they're adults when they make that decision, and it is their decision. And I can remember saying to them, every decision is I will support, I will be there. But it's tough because you have to say goodbye to them. Chris had it done in UCLH, and having to say goodbye when he walked across to the anaesthetic room, and not being in recovery with it. It felt like I was almost physically removed from my child, because this was his 6th off surgery, and I'd been there all the other times, so that was uplifting as well for me. But yeah, the bruising, watching the bruising was great. Bruised down your chest as well, do you remember?
I did, I had a bruise that
A bit.
That's where the surgeon stood on.
So, I mean, we were saying how good this forum is, because it would have been so much more beneficial for us to have attended something like this before his surgery, to find the worst case scenarios, and to find how other people manage to eat and drink and find some normality during that really swollen period. But it's good, it's all good.
Val, what was your experience?
I think we've been prepared for the post-op thing, and constant smoothies and trying to make soups that every person said he hates soups, so that was a waste of time. So we've been prepared for that side of it. I think I wasn't quite prepared for. I think he was quite unhappy for about 4 weeks after the op and didn't smile, partly because of the tight elastics. So just trying to encourage him as the swelling was going down, just saying, look, this is looking really good. But he still wasn't smiling yet.
Yeah.
So it just took a little while. But yeah, we were prepared, I think. I think we had a much easier hospital experience because we were in Great Ormond Street, and that was just so nice. In fact, everybody stayed there actually, probably for a week if we could have done to get him out.
Yeah. Was that because before it was done before you were 18, or was there a specific reason?
I think because I was supposed to be having it done in July, and then I came in, I was in the gown and everything, and then it got cancelled.
Okay.
So I think maybe they felt bad about that or something.
Very kindly.
Yeah.
Okay. Okay.
I forgot to add actually, which is quite funny now, it wasn't at the time, but when they discharged Chris from UCLH, we had to wait several hours for pharmacy to produce painkillers, and then they produced tablets.
Yeah.
Which of course he couldn't.
I had that as well.
Yeah, he couldn't take tablets, so it was a complete waste of time. Because that was UCLH, obviously. Great Ormond Street would have been geared up to know that he would have needed.
Maybe that is something that we can take back to the team, actually.
But it's funny because he wasn't discharged until 6 o'clock that evening, so to be without his old painkillers for that time wasn't funny.
Yeah. No,
and
that's.
Didn't even think about it, didn't even cross my mind at the time. But maybe.
Well, you wouldn't.
Yeah. And it's not just painkillers. They actually work in an anti-inflammatory way, so they can reduce the amount of swelling as well. So it's doubly important to have those painkillers.
They taste disgusting, but take them religiously. Religiously.
They do their job.
Yeah, they really do have.
I remember being so sick of it that I tried to get paracetamol like through the wire, but it just got stuck to it. And you just had to sit there and dissolve in my mouth. And I was like, oh no, like it's caught in between the elastic, and I was just like,
not nice.
I give up.
If there's anything like really practical that you could, I mean, you were talking about not being able to talk. Is it handy to have like your notepad there with your? What would you, for really purely practical advice that could make your life easier during the or just before the op or straight
You're
after?
surrounded by good people, like people that will be there for you, like that won't come and laugh at you, because it's not a laughing matter at the time.
Yeah.
Like I remember my friends were really good, but my brothers were appalling. They literally was like, oh, you look like football. But my friends were really nice, and like, just make sure you're surrounded by good people, because you need people to help you.
Yeah.
Because you can't, and don't be stubborn, because I was really stubborn. I was like, no, I don't want anything, like, I'm fine. But I was shooting myself in the foot, because when you have people there to help you for a reason, use them. Like, don't push people away because you want to be on your own, or you're tired, you're in pain.
You become quite reliant on, although you're not necessarily in the children's wards, so that you can't have your mum there all the time, or your dad, you do become very reliant on your parents, even at home, because it's big surgery, and I would struggle to even really shower or wash my hair, because I couldn't stand up for very long and have that pressure of the shower on my head. Initially, I was told to try and avoid too much anyway. So even those little things, when you can't eat very much, even just getting to the kitchen and standing for 10-20 minutes to make yourself some food, all these really trivial things that we take for granted every day, actually well, for me anyway, I needed my mum to help me. I needed my mum to even help me sometimes even change. And I think coming on to that, the practical things, I think two things I'd say is Vaseline became my best friend. Your lips become so dry after surgery, and they can get so sore and like cracked and even bleed, or sometimes you might have like dried blood on them maybe. So yeah, Vaseline definitely. And the other thing is like loose clothing, because lifting things, I remember lifting things over my head, or I was so scared of things touching my face because it was big and swollen and painful. So yeah, nice baggy clothing as well.
Yeah, with buttons maybe
Yes.
that don't need to go over your head. Okay, that's all really good advice. Anything else?
Have loads of like milkshakes and smoothies.
Yeah. Were you guys hungry? Were you guys a bit cranky because you were hungry?
I was emotional.
Yeah, I think what I would say, the best advice I could give, and really I think it is just repeating what these guys have already said, is that it is going to be a bit of an emotional roller coaster when you come out, and just having other people there. And I even remember just sort of having friends around at different points. You know, these are people that do pick you up if you're not particularly feeling very good on one day because you're in, you know, a lot of pain that particular afternoon. Just having people around as like a distraction and as a pick-me-up was really helpful. So I think that would be my best piece of practical advice. I don't know if you could argue it's practical, but I think it is, really.
Also, don't jump the gun too much. Like, I mean, I remember when I the next day after surgery, I was like, yeah, I'm ready to go home. Went up to go to the toilet. In the toilet with my mum, literally nearly face down the floor because I was like, you think you're feeling better, and you take don't run before you can walk. Like it's anaesthetic is a big thing for everyone, and it takes a lot out of you, and you don't realise how much it takes out of you until you're doing basic things like getting from a hospital bed to the toilet. Now it's like, yeah, it's easy, it's over there, but for just after surgery, it's like a marathon. It's taken step by step, and I think, I mean, it wasn't a nice thing, and I think it made me realise that maybe I'm not ready to go home. You need to think about things after and think about what you're doing before you do it. Because I remember brushing, I had to literally stand there and tell myself to brush my teeth, because doing that was, because you've obviously got stitches all along the sides. Brushing your teeth was, it was just another thing. Like now it's easy. Back then it was so hard to get a toothbrush all the way to the back of your teeth to even just freshen up, because your mouth feels so horrible. And it's scary when you're spitting and you just see blood and you see a stitch. It's like, oh my gosh, like it's just taking it day by day and step by step, and just making sure that you are prepared for it. Don't always ask questions. Don't think that the question isn't answerable or stupid, because it's not at all.
How long were you in hospital for after the ops?
3 days, I think. I hate being in hospital, so as soon as I come out of surgery, I am doing absolutely everything I can to prove to my doctor that I'm well enough to go home. The main one being able to go to the toilet, walk to the toilet by yourself. So yeah, still, I think it was probably on the 3rd day I got to go home.
I think it was just one day for me, I think, wasn't it? Yeah, it was the day after, but I'm exactly the same, so I absolutely hate being in hospital longer than I have to be, so I'm pretty determined to sort of make my case to go home ASAP.
I think I had it then, I was the last one on the surgery list because I was on the older ones. So I had it that night, and I was out in the car the following afternoon, late afternoon, early evening in the car, going home, thinking, like, looking at the hospital, thinking, I don't ever want to go back to you again.
I was there 2 days, one night and then the following day.
Is there a general rule how long?
As soon as you can.
As soon as you can get to the toilet, as soon as you can drink, and your pain is controlled, you get you home. I mean, ideally, I say to patients, and exactly like this lot say, most people want to get home, and they've got the drive there to do it. Some people haven't, and also it depends a little bit on parents, because if parents are being a little bit molly-coddly sort of thing, they might be a bit scared of taking people home. Sometimes the child will want, or that adult will want to go home, but the parents won't feel comfortable. So, I mean, I personally would like people to go home the next day or the day after it's taken, so 1 or 2 nights.
Being at home, your own environment, your own bed is a massive comforter. Hospital's not a nice place. I don't know why anyone would want to stay there. And you can get out, run.
I think that I probably, by the sound of it, I was over there the extra night because although my operation was in Salisbury, I actually live on the Isle of Wight, so that trek, it wasn't exactly easy if I had an issue to quickly nip back. So they were always very mindful of that and just make sure that I'm okay.
Right, does anybody have any further questions? Because I'm just a bit aware of the time, and we are, for a reason, in a bowling alley, which is that we could get some bowling in afterwards for those who want to do bowling. But I just really want to thank you, the four of you, for coming. I think this is a pretty special thing, to be able to hear experiences from ex-patients. So, I mean, I think... And we are hoping to roll out these forums on a more regular basis, so maybe you will be able to come and talk as ex-patients towards younger patients who are going to have it in the future. So, you know, we're all part of this community, we're all here to help each other. I've got a little thank you for you guys. Chris, yours, I'm going to post it, so please do make sure we've got your address, because we